I'm going to now turn things over to Director Hertel to get us started.
Thanks, Andy. Good morning, everyone, and thank you for joining us. Today, I'm here with our Chief Medical Executive, Dr. Bagdasarian, and two representatives from Michigan's medical and hospital community to provide an update on COVID-19, where we stand, and what we're urging everyone in Michigan to do to stay healthy this holiday season and end a surge that is threatening lives and our healthcare system. It's impacting everyone who may need access to healthcare services. Dr. Bagdasarian will go into further detail on trends in a moment, but we are now 2 weeks past Thanksgiving, and Michigan continues to trend in a deeply concerning direction, heading into the Christmas holiday and the New Year. And as we announced last night, the Omicron variant now has been detected in Michigan. How easily that variant spreads remains unknown, although all indicators are that it is more transmissible than the Delta variant. First and foremost, I want to thank our healthcare workers who have been on the front lines of this pandemic. I also want to thank the more than 5 million people in Michigan who have been fully vaccinated and everyone who has already received their booster or has made their appointment to do so. For individuals who have not yet been vaccinated, I want to be absolutely clear. You are risking serious illness, hospitalization, and even death. Even people under the age of 65, including individuals in their 20s and 30s, are testing positive and ending up in the hospital. In fact, in the past 7 days, 30 to 39-year-olds are experiencing our highest case rates. Overall, only about 2% of people who were fully vaccinated have been reported with a breakthrough infection. Based on data from most health systems in Michigan, 3 out of every 4 COVID patients are unvaccinated. If you have yet to receive the vaccine or you are not yet fully vaccinated, it is not a matter of if you will get sick, but when, particularly with a more transmissible variant spreading across the state. Hospitals across the state are struggling to treat COVID-19 and other high acuity patients due to this surge in severe cases, visits, and longer hospitalizations. MDHHS is working with local, state, and federal partners to support our health systems, address this surge, and try to save more lives. We're coordinating the allocation and monitoring of federally distributed monoclonal antibody treatments with a diverse group of providers across the state. We're also working with the Office of the Assistant Secretary for Preparedness and Response and FEMA to identify federal staffing resources to help support the delivery of outpatient monoclonal antibody therapies across the state. Vaccines, however, remain our best option to protect yourself from severe COVID or death, but monoclonal antibodies are an important tool in our toolbox to reduce the chance of severe outcomes and the strains on our healthcare system. We're working with our regional healthcare coalitions and hospitals to supplement mechanical ventilators to meet this surge of demand in ICUs. This includes deploying the state supply and requesting additional ventilators from the National Strategic Stockpile. To make sure our hospitals, skilled nursing facilities, schools, adult foster care, and assisted living facilities, EMS agencies have the protection they need, we're working with Michigan's 45 local health departments and our 8 regional healthcare coalitions to supplement local supplies of personal protection equipment using a supply maintained by the state of Michigan. The Division of EMS and Trauma within our department has also provided emergency protocols for medical control authorities to better facilitate operationalizing the EMS system and expanding pre-hospital clinical treatment. In addition, we're working with federal officials to identify federal staffing resources to continue to support hospitals. At this time, as you know, there have been 3 Department of Defense clinical teams mobilized to assist with staffing at Beaumont Dearborn, Spectrum Butterworth, and Covenant Healthcare. However, if the strain on hospitals increases, there are no additional federal teams available at this time. So while we have been taking action to mobilize resources available to us, this illustrates the severity of the situation and the reason it is important that every person and family in Michigan take this surge seriously. Already, sometimes dozens of people are waiting at emergency departments for non-life-threatening visits due to the uptick in individuals coming through the emergency room doors with COVID-related symptoms. In some cases, hospitals have had to close their emergency departments for extended periods of time. This is serious, and the surge not only has the potential to impact your access to care if you remain unvaccinated, test positive for COVID and need hospitalization, it also jeopardizes the ability of you or anyone in your family who needs care for other conditions or unforeseen emergencies to access that care when they need it. Right now, every person in the state has the opportunity to drive our numbers back down, reduce the strain on our healthcare system, and protect yourself by first and foremost getting vaccinated, getting your kids 5 and up vaccinated, and encouraging your friends and family to do the same. Vaccines remain our best, most effective tool to avoid COVID-19 infections, hospitalizations, and death, even when it comes to more transmissible variants like Delta or Omicron. Getting a booster as soon as it's time. Yesterday, we're excited to say the CDC announced an updated recommendation that 16 and 17-year-olds can join people 18 and up to receive a booster dose. For now, following the public health advisory and wearing a mask regardless of vaccination status, staying home if you are sick, and if you think you may have been exposed, getting tested so you can let your close contacts know if you test positive. I think that we can all agree we're ready to be done with this pandemic, but this pandemic is not over. It is going to take all of us, and this is a critical moment. We're here together, medical experts and public health, urging you to take steps to protect yourselves, your loved ones, and your communities now. And if you choose to gather for the holidays, this is a crucial time. And now I'll turn it over to Dr. Bagdasarian, who will go into further details about our COVID-19 and vaccination trends.
Thank you so much, Director Hertel. I have some slides I'd like to show to explain just how critical the situation is. Thank you so much. I want to start out by saying that we have seen the highest weekly reported cases during the surge as we have in the whole pandemic. We're currently at 569 weekly cases per 100,000. And when you take a look at how we're comparing to previous trends, you can see that we are exceeding some of our rates in previous trends. Next slide, please. Cases are actually higher today than at this time last year. And unlike last year, numbers are actually expected to rise following Thanksgiving. So you can see this year is the light blue line, last year is the dark blue line, and you can see that we're actually over our case rates compared to a year ago, and that trend is continuing to go up. Next slide, please. Hospitals are stretched to capacity, as Director Hertel mentioned. In terms of our percent of inpatient beds that are filled with COVID-19 patients, we are at an all-time high. We're at 21.5%. In previous surges, we have never exceeded 20%. And this has been going up for the past 20 weeks. Hospitals are really feeling the strain. They're feeling the strain not just from COVID cases, but from other cases where people have delayed seeking care. Next slide, please. We are now seeing COVID-19 mortality increasing. We're currently at 9.6 COVID deaths per million, and 87 people died of COVID-19 each day in the last week here in our state. 87 people each day. Just want to emphasize that number. Next slide, please. This slide looks at excess deaths from all causes. And so what you'll see here are two lines that show where our expected mortality rates are based on previous trends. And when we look at the bars that are above that line, when we look at the green bars above that line, that tells us that non-COVID deaths are actually higher than expected in this surge. So not only are patients with COVID-19 dying at higher than expected rates, but people with other illnesses or other diseases are also dying at higher rates than expected. And this really signals to us that hospitals are overwhelmed. Next slide. Omicron has been detected in Michigan. It's been detected in 25 states around the country. Our preliminary data indicates that this variant is more transmissible than other variants. Our early data also indicates that vaccines will continue to offer protection, especially against severe disease and death against this new variant. The role of booster shots becomes more important than ever. The role of making sure that people are fully vaccinated and then have received their booster shot is really vital right now. Next slide. Michigan continues to be below the national average when we look at our vaccination rates. Only 56% of Michiganders are fully vaccinated. As I mentioned, this is below the national average, and we are performing significantly worse in younger age groups. So as we look down into our 30-year-olds, 20-year-olds, and children, our vaccination rates are not where they should be. And I want to highlight that communities with low vaccine uptake are vulnerable to further increases in COVID-19 cases, worse outcomes, that means more severe cases, more people in the ICU, more deaths, and more strain on health systems. And we simply cannot take this right now. Next slide. I also want to stress that vaccines work. We do see breakthrough cases, but that is expected as the number of people vaccinated grows. But we can say the risk of becoming ill or dying is much higher in those who are unvaccinated. When we look at Michigan data from September of this year, unvaccinated individuals had a 4.4 times higher risk of testing positive for COVID-19, and they had a 9.3 time risk of dying from COVID-19. So these vaccines do work. And as we think about Omicron, vaccines are really the best way for us to prepare. I think, Andy, that's the end of my slides. But I just want to summarize where we are with the situation. The situation in our state is critical right now. Cases are surging, hospitals are full, and we have a new variant. I strongly urge all Michiganders to, number one, get vaccinated, get boosted, to wear a well-fitting mask whenever you are in indoor public settings, and 3, get tested. So get tested if you have symptoms that could be COVID-19, get tested if you feel you may have been exposed, get tested before any unmasked gatherings. We're really at a critical place in this pandemic, and it's really time for everyone to do their part. Thank you. I'm going to hand over now to Dr. Chimise, who is an OBGYN from Spectrum, and we'll talk a little bit about the vaccine and pregnancy and fertility. Thank you.
Thank you, Dr. Bagdasarian. I'm Michael Chimise. I'm a maternal fetal medicine specialist at Spectrum Health in West Michigan in Grand Rapids. Maternal fetal medicine is essentially a field of high-risk pregnancy, which means that all my patients are pregnant, and all my patients, and the predominant biggest part of my patients, bulk of my patients, fall in that 20 to 30 year-old age range. And we see the sickest moms, and that falls under our purview. What has happened is, just kind of extending from Dr. Bagdasarian's discussion, we know that in pregnancy especially, there are immunologic and changes in the lung systems of expectant mothers, which actually can make moms very much more susceptible to getting sicker from COVID. And this is a concern. I mean, multiple studies have shown that moms, or expectant moms, actually see a higher rate of ICU admissions simply because they have trouble getting enough oxygen. So they're requiring ICU level care. They have a higher risk of needing respiratory support, higher risk of needing intubations, which is essentially a tube that's placed down the throat, which allows oxygen to be delivered directly to the body. And also a higher rate of something called ECMO, extracorporeal membrane oxygenation, which is a method where by the lungs can no longer fully oxygenate the blood that's entering the lung system, and the actual blood is actually pulled out of the body. It's oxygenated artificially and pushed back into the body because the lungs are so damaged. And these are all higher in pregnant moms. So, at the beginning of the pandemic, we would have isolated cases of moms in the ICU. But currently, we've spent a large proportion of our time rounding on the inpatient service in the ICU. The only question is, how sick were the moms and how many of them are there? And it's very consistent. We spend more time in the ICU than I've ever spent in any time in my career. And why is that the case? Well, unfortunately, we know that Michigan is falling behind in vaccination rates. So if 50%, 56% of Michiganders are vaccinated, our pregnant moms are about half that much. 30% is the vaccination rate estimated in pregnancy, which means that moms can actually get sicker because they're less vaccinated. So typically what happens in an ICU setting has become very disconcerting. We have moms that, enter in because they have trouble breathing. They enter into the ICU and they may require extra oxygen, extra help breathing, intubation, ECMO. And then all women who are beyond 23 weeks and beyond actually require some sort of fetal heart rate monitoring. And that's an added level of surveillance that we do in the ICU. So someone is constantly watching that fetal heart rate. What we also do in the ICU is that we actually have to bring in what they call these crash carts. These are carts that are brought into the ICU suite, and they essentially are a cesarean section tray, which can be opened at any time. So if a mom were to acutely decompensate because the lungs are failing, we'd have to perform a cesarean section for that potential fetus and deliver the fetus in that situation. And that's been done before, and it's intense, and it's something that you would only expect to see a handful of times in your career, but we've started to see it more regularly, which is very, very scary. The other thing that we have seen also is that immunity from the vaccinations actually is more robust for neonates. We see that the immunity from a vaccination gives the protection, and those antibodies are passed on to the fetus with a robust protection, more so than a natural infection. So we know that vaccine is the best way to not only protect the mom, but also protect the baby as well. The other thing that has been that was proliferated early in the course of the pandemic was the concept of fertility, suggesting that the vaccines were a cause of fertility. And that has been debunked. The most, I think, definitive study was done in June of 2021, which was reported out of a group that actually did IVF. So they basically looked at moms who were undergoing an IVF procedure, which is an implantation of the embryo into the uterus. They subdivided the moms who had been fully vaccinated versus the moms who had natural infection and were unvaccinated, and moms who were unexposed and unvaccinated from their blood tests. And they actually showed that the implantation rates from an IVF procedure were baseline. They were no different than in any of the three groups. So it suggests that not only can vaccinated women have the same implantation rates, the same clinical pregnancy, and the same sustained pregnancy rates, but there's no difference in any of those categories. So the vaccine does not cause infertility. And we have seen now that the vaccines have been available for approximately 1 year, we have seen a number of mothers who have been fully vaccinated, who come to the clinic, who have wonderful pregnancies. They're able to continue their pregnancies safely, and they're able to keep those pregnancies, and they go on to deliver healthy babies. And that's ultimately our goal. And so that indicates to us that the vaccines do work, and they don't cause infertility. And we've seen this time in and time again. So I think that that is a big issue to keep in mind. I think that's all I wanted to say about that currently. I will now hand it over to Dr. Marciano, who will take over.
Thank you very much. And again, thank you for the opportunity. So, as I reflected the message I wanted to convey during this press conference, I did a little bit of soul searching as to what is different now from the first surge over a year or so ago was very memorable because at that point in time, we as physicians, we as hospitals were really struggling to figure out exactly what this disease was. And there was kind of an innate fear to oneself and trying to uphold that Hippocratic oath and mission to our patients. However, as we settled in and the medical community around the world gave us a pretty clean laundry list of how to treat it, it just kind of settled down. And so the second and third surges, were a lot less visible in the eyes of both the patients and the healthcare providers. However, during that period of time, there has been kind of a shift within the healthcare workforce and the workforce across America. And what is very unique about this fourth surge is the concept of functional vacancy. So when it comes to pure numbers of COVID, Beaumont is the largest health system in Michigan, and therefore the total number that we have in our hospitals directly relates to the total number across the state of Michigan. We have just hovering around 650 patients. And once again, just like the numbers shown previously, the vast majority, over 3/4 of them, are unvaccinated, and higher so those that are COVID positive into the intensive care units. However, once again, the functional vacancy rate or total number of open positions across the health system is higher than 10%, and more so that in nursing, higher than that. And so what we're seeing is a pressure to be able to not only maintain the standard of care, not just about COVID, but across all the diseases, and also try to maintain a certain level of experience for the patients. And so a few weeks or so ago, I'm going to interrupt and give you a footnote. Another thing that we learned very much from the previous surges, except the first surge, is that we as hospitals cannot stop the delivery of healthcare. We cannot exclude the non-COVID patients from getting treatment for the diseases that they had. That was probably one of the first points that we all learned during our first surge, where we essentially shut our doors to concentrate on the COVID patients. And so the challenge with this increasing rate of functional vacancy, impending surge or rising surge, and the necessity to continue that level of care is reaching a point that I've never experienced before. And a few weeks or so ago, we really sent out help. And it was a very sobering, as a leader, it was a very sobering moment in my life. But I'm so thankful that it was heard. And FEMA and the Department of Defense sent us a contingent of physicians and nurses from the U.S. Army to help out the hospital. And that has been a tremendous lifeline because it addressed that functional vacancy rate. It allowed us to be able to care for the COVID patients and at the same time still maintain the level of care that cancer patients require or people with chronic illnesses. And so where we are today is really just keeping our heads above water. The FEMA / Department of Defense DoD team is on site. They're integrating, they're providing care side by side by our physicians. And I think once again, I am positive that the outlook for the future is good, and we don't have to stop the elective cases or defer maintenance of chronic care during this fourth surge. With that said, I'm being quite positive because I'm hoping that we're going to crest the surge at some point, although I'm not clairvoyant and absolutely can be wrong on that. With that said, the other kind of retrospection that came across my mind is how the challenges under this pandemic continually change. Healthcare institutions are very complex organisms requiring, solid supply chain in addition to staffing. And while I talk about the severe nurse shortage that we have, there are shortages in environmental services. If I can't turn the room around that is dirty to clean, I can't put a patient in it. food workers. Again, the patients need to eat. We need trays, transporters, right? We need people to be transported to different departments across the hospital. So all of those are pain points, and it's difficult to predict, which one will be today. And the final piece, and if I were to say anything to the state of Michigan, is, tried and true methods have worked. Masking, social distancing, hand hygiene. I don't want, we should have really been doing those from the beginning as a race, but they're crucial now. They have proven to work. They take minimal time. And then again, just showing that the 73/4 or over 3/4 of the patients, with COVID in the hospital or unvaccinated, not just the full vaccine, but the full vaccine plus booster, because we realize that the memory effect of that intervention or having had COVID won't even span 12 months. So that is a solemn plea from the health systems that are trying to not just maintain a certain standard of care for the COVID patients, but the Michiganders in our service areas, and try to maintain that kind of experience of caring and empathy that we should be doing. And so with that solemn plea, I'll turn it over back to Andy. Thank you.
Thank you so much, Dr. Marciano. We have several questions. I'm going to try to get through as many as possible. So let's begin. This question I'm going to direct to Dr. Bagdasarian. What do we know about the Omicron variant so far?
The early data indicates that it is likely more transmissible. We know that reports in places like South Africa and other countries are reports of milder cases, but that doesn't tell us that it's going to be milder on a population basis. We really need to understand how much of this is protection from vaccination and prior immunity, and how much of this is because it's a young, healthy population in general who are being exposed in South Africa. So we need to see what this means for our population here. What does it mean for people who are immunocompromised? What does it mean for people who have other underlying conditions or who are over the age of 65? And we don't understand those questions yet. What we do know is that vaccines are most likely going to still be protective, especially against severe disease and death. And so as we think about how to prepare for Omicron, the most vital thing to do is for us to get our vaccination rates up, to make sure that all Michiganders over the age of 5 have their primary series, and that all Michiganders over the age of 16 have their booster as well. So we really need to work together as a community. We're in a critical stage right now. We are surging, we're leading the nation in terms of cases. We are trailing in terms of vaccinations, and we have Omicron here. So now is the time to take those steps. And I'm really urging all Michiganders to get vaccinated and get boosted. Thank you.
Thank you. On the note of Omicron being more transmissible, there's a question about, does this change your thinking on requiring students to wear masks in schools? I'm going to direct that to Director Hertel.
We have recommended to schools that they should mandate masking in the classrooms. It does not change our opinion on that at all. And we certainly are advocating for all those children in school over age 5 to get their vaccines.
Great, thank you. How many ventilators have been dispersed from the state stockpile, and how many ventilators have been requested from the national stockpile? Director Hertel, do you have that information?
I saw that question. We'll have to get back with the exact numbers because I don't know offhand today.
Okay, Dustin, that question is from Dustin Walsh, so we will follow up on that question. Thank you. Are hospitals being forced to cancel or delay critical services and procedures due to COVID hospitalizations? And what does this mean for those patients needing this care? Dr. Marciano, can you speak to what's going on at your hospital?
Yeah, so I mean, I would say across Beaumont as a whole, once again, one of the pointed features that we learned from the first surge is deferring chronic illnesses is not the answer. So what we're trying to do right now, hoping that this surge is limited in temporal scope is just load level, right? Is to be able not to do too many surgeries on Tuesday, because then the bed requests will lag and then the care will be delivered in alternative areas instead of where they should be. So we're trying to load level right now. We are trying to push some surgeries that can happen outside of the acute care site. And again, like as I mentioned to you before, with the help of the FEMA team, we're able to keep our head above water. We are still doing emergent surgeries. That has not changed, and those clearly have precedence to those surgeries that can wait a day or two or a week or two. So we're doing what I consider to be just articulate load balancing, and it's a tough juggling act, to say the least, because every patient's surgery is needed. So I think that's the best answer of what we're currently doing across Beaumont right now.
Thank you so much. And I'm going to also direct this question to you, and you can speak to your experience at Beaumont. How does this current situation and the current surge we're in compare with the early days of COVID in terms of the need for hospital beds and PPE?
Yeah, thank you. So as I alluded to before, there was a lot of camaraderie during the first surge. There was a lot of fear of the unknown, but everyone was all boots in the ground. We were very well staffed. You know, we again deferred elective surgeries. We shut the pipeline down. And so it was all boots in the ground, everyone ready to work. And so that in the present case was a wonderful feeling. You know, nowadays, you know, and at the same time, given the fact that Beaumont is a large purchaser, we always had the PPE that we needed. Granted, we were a little short on the peppers or very specific PPE that we needed, but all that was reconciled relatively quickly. Again, today, the functional vacancy rate, overall burnout, I mean, a lot of the healthcare workers thought that that was one and done, right? But it isn't one and done. We're still experiencing the same feelings that we have a year and a half or so ago. And a lot of healthcare workers are deciding to go other places. And so that functional vacancy rate is really a stressor. And like I mentioned to you before, you know, healthcare institutions are complex organisms. There's a tremendous number of supplies that we need to be able to deliver that care. You know, Bovie pens are specific pens that they use in the operating room to separate tissues. We ran out. We can't order anymore. Supply chain disruptions are very much the norm these days. And again, it's very devastating from a health system perspective and very unique. So PPE, we're good. Supply chain disruptions, it's very difficult to know what we're going to run out of today versus tomorrow. But it is the kind of burnout and frustration and exit of the typical healthcare worker, which is just, you know, devastating.
Thank you so much. We've had several questions around, you know, at what point or if restrictions will go back into place. Elizabeth, can you, Director Hertel, can you comment on that?
Right now, our focus is making sure that people are getting vaccinated when they're eligible and getting the booster shots when they're eligible. Masking is important while we go through trying to achieve our herd immunity through vaccinations, but vaccinations are the absolute best tool that we have, and it is imperative that people get vaccinated as soon as possible or get their booster shot if they're eligible.
Thank you. We had a question about the Omicron case that was found in Kent County. Is there any information about the gender, the age range, or the current condition of that case that was found? Dr. Bagdasarian, do you have any of that information?
We can't share specifics about that individual, but I can tell you that it was a mild illness.
Thank you. there's a question around ventilators had meant a high level of death, a high death probability of death. Has that changed at all? Maybe Dr. Marciano can speak to that in your experience. Have you seen that patients having to go on ventilators tend to have poorer outcomes?
I'm going to be very generalized here because every patient's disease is unique, but ultimately, if one's body cannot breathe for oneself and requires mechanical support, it's never a good sign. And especially if COVID is one illness on top of a bed of other illnesses, which then results in hypoxemia and the use of a ventilator, it's never a good sign. So, sweeping generalizations, which I fear to make in medicine, but ultimately it is never good.
Thank you. There's a question around, does the state's modeling indicate when this fourth surge may crest and then subside? Dr. Bagdasarian, could you speak to that? Is there, do we have information on that?
So modeling can only tell you so much. Modeling can only tell you when you have an expected behavior or an expected intervention. And right now, we are really counting on individual behavior. We're counting on people to get vaccinated, to get their boosters, and to take precautions like wearing masks and getting tested. So we have looked at some modeling about what increasing our vaccination rates looks like, and that could definitely help us here in Michigan, and that could bring down the curve. But again, we're counting on individuals to make that decision. So it's up to Michiganders now to take those actions and help us bring down our curve.
Thank you. Is there any concern right now that because many people are starting to be due for their boosters, that this has contributed to the increase in COVID numbers across the board? Or is this really only spreading through and to the unvaccinated? Dr. Bagdasarian, can you address that?
Waning immunity is certainly going to play a role in all of this, but what we're seeing is that this is predominantly a surge of the unvaccinated. When we look at what's happening in hospitals right now, we have a snapshot from November 29th. 76% of our hospitalized COVID patients were unvaccinated. 87% of COVID patients in ICUs were unvaccinated, and 88% of COVID patients on ventilators were unvaccinated. So while there is a role for waning immunity, and while we need to really encourage people to get boosters, we need to also focus on those who have not yet received their first dose. And I mentioned this in my earlier remarks, but our vaccination rates, as we look in younger age groups, is significantly lower than we need it to be. When we look geographically across the states, there are pockets and communities that remain holding out on vaccine. And those are the communities and the age groups who are most at risk. So we're at a critical point right now, and we need to get people vaccinated. Thanks.
Thank you. Lots of questions coming in. We're going to try to take a few more. There's one here. Lansing patients are seeing wait times of up to 90 minutes for a COVID-19 test. Is the state, or has the state, considered mobilizing large-scale testing sites? Director Hertel, do you have any information on that?
There are a number of testing sites across the state. I know the Frandor location in Lansing is very popular, but almost every pharmacy offers testing, every urgent care offers testing. We recommend people go to our website, mdhhs.gov/coronavirus, and go to the test finder to find a location near you.
Thank you. How much longer are COVID patients staying in the hospital? Do we have any information on that? Dr. Marciano, can you speak to that in general?
Yes, thank you. So, it's a complex question. I can tell you that they're staying longer, I guess, than its compare group if you would use a pneumonia. But some of that isn't necessarily due to the degree of illness. Some of that is the fact that they don't have a home in the post-acute setting, whether it's skilled nursing or long-term care facility. So, if I were to look at our adjusted length of stay as compared to the geometric mean, it is high. It is high. But I just want to make the point that I think COVID is not a pleasant disease, but I think from a clinician standpoint we can address it. Could we address it better in the future? Absolutely. But I think we have a pretty good gist of how to treat it. And so we're finding that the length of stay for that specific patient population is more due to delays or disruption in the post-acute setting than the severity of its illness. I guess, I don't know, hopefully that makes sense.
Great, thank you. This is gonna be the final question here. There's a follow-up on the DoD teams being available. Director Hertel, you had mentioned that no additional DoD teams were going to be available. There's a statement about, we've heard that additional hospitals say they'd like to request them if needed. Can you speak to that?
Yeah, we do not have an unlimited number of healthcare providers in this state or this country. There are a limited number of these sort of medical assistance teams from the Department of Defense. We have 3 of them deployed in Michigan right now. There are other states that are also utilizing these resources. There are no additional federal resources available. We do and have worked with our hospital systems to provide information on short-term staffing contracts with private agencies. But again, the number of healthcare providers is finite, and they are all working often, and they have been for a long time now under pandemic conditions. So we are doing everything we can to help to support those resources, but it really will be, it will take the efforts and the actions of our citizens and our communities to help to slow the increased number of patients into the hospitals to really ease the burden.
Great, thank you. Well, we had some other questions coming in. Please follow up with me. You have my information is in the chat. I'll place it there again as we wrap up here. Thank you all for attending. We're going to be sharing a recording of today's briefing and Dr. Bagdasarian's slides that she shared with the email address that you used to register for this webinar. So if you'd like to request that separately, please email me. And with that, happy holidays, stay safe, and thank you all for joining us today.